Hello and welcome to this Levelling Up Goals webinar. I'm Ian Dale. The title of today's hour is Levelling Up Health, the NHS as an Employer. And obviously, I think the NHS is the biggest employer in the UK, so there are tremendous opportunities here to talk about how the NHS can help level things up in our country. So let me first of all introduce our panel. It's a very large panel today. First of all, delighted to welcome Anne Milton. She is doing the Stars in the Rose version of Justine Greening today. She's going to be leading us off in just a moment. Anne trained as a nurse at St Bartholomew's Hospital, and she was Conservative MP for Guildford from 2005 to 2019, Anne?
It is 2019.
I thought I was right in that. And was also Public Health Minister in the coalition government. Karen Smith is Shadow Health and Social Care Minister and Member of Parliament for Bristol South. And she's joining us from a very blowy Northern Ireland today, she says. And she's been MP for Bristol South since May 2015 and has been a Shadow Health and Social Care Minister since December 2021. And before she went into Parliament, she worked as a nurse in the NHS. Oh, actually, did you work as a nurse, Karen? You worked in the NHS, I know. No, we'll come on to what your position was there in just a moment.
Patricia Davis, a manager in the NHS.
A manager, okay. Patricia Davis is Chief Executive of Shropshire Community NHS Trust, and she's been doing that job since April 2021. And she joined the trust from Bedfordshire, Luton and Milton Keynes CCG, where she was an accountable officer. Jodie Hernshaw is Charity Manager of Airedale NHS Trust, NHS Foundation Trust, and Justine Steele is Executive Director of People and Organisational Development of North Cumbria Integrated Care NHS Foundation Trust. That is a real mouthful. Well, let's hand over to Anne to give us an introduction to the kind of subjects that we're going to be talking about for the rest of the hour.
Thanks very much, Ian, and just to welcome all of you. Some of you I've met before, so it's great to see you all here. This is all about levelling up and what role the NHS can play in that. Interestingly, when Ian introduced me, he pointed out that I'd been Minister for Public Health. Oddly, I think the more relevant experience I had was as Minister for Skills and Apprenticeships, because the NHS as an employer, I think, can have a very major impact on levelling up this country. If you look at health outcomes, probably education correlates closer with those health outcomes than almost any other intervention. So the role of an employer, their opportunity to train, retrain, upskill people within their communities is absolutely massive. I think particularly if you consider the huge range of jobs that are available in the NHS. I don't think there's any single employer that has such a wide range of opportunities available. The public tend to think of just the health allied professions, but in fact, admin, IT, lab work, there's just hundreds of them. So there's great opportunities, not easy to navigate, I don't think, as chief executives or senior positions within an NHS organisation, but it is possible. And one of the whole reasons to be of the purpose goals is about breaking this down into biteable chunks that you can swallow, chunks that you can accumulate to make sure that you can all have the maximum impact, the most purposeful impact on your local communities.
Karen, do you want to follow up on that? Talk about levelling up in the NHS from where you stand.
Yes, and I think absolutely right there that the job that she did as skills and apprenticeships, and I worked closely with her in that role because apprenticeships is something that I've championed for Bristol South for all sorts of areas, but particularly on health. And I had worked as NHS manager locally. And although the large trusts come to my apprenticeship fair every year, we do still have real problems recruiting, particularly the lower level apprenticeships into the health service, the health and care service, and then helping people rise up the ladder. I think apprenticeships do offer that opportunity, but we're really struggling at the moment with lower level apprenticeships. We're really struggling with the skills across the care and health sector.
Why is that?
And it is something. I think because traditionally the NHS has got very different terms and conditions. The NHS has been quite siloed in its recruitment, and I think it's difficult to recruit across a geography. We have relied on, the health service has always relied on immigration, but I think the need to very quickly recruit people of particular skills means the NHS does look more internally. And what we need to do, and the government I think is trying to suggest in its myriad of white papers around this subject, is ways to skill up the care workforce and encourage people to be able to work across both sectors. And that's quite a challenge. It's expensive because if we offer a career ladder to care workers, then we need to pay them accordingly. And currently they're paid at much lower rates than NHS staff.
It's odd, isn't it? Because although youth unemployment in this country is lower than most other European countries, it's still, I think, around 10%. So you think, well, if it's still 10%, why would there be difficulties in recruiting to the NHS, given that all the surveys show that people actually would quite like to work in the NHS, even at younger ages?
But I mean, I think what I found locally is that I think community services and primary care are better at this than large acutes. I'm conscious of talking to some chief executives on this call. I think it's very variable across the country. I think some trusts do it better than others. But I think if you can persuade people, which I always do, as Anne has said, get yourself into the health service and then skill yourself up and be able to work wherever. The jobs variety is enormous. Terms and conditions are still pretty competitive in most places, and there's a pension at the end of it. But at lower levels, we are competing with a lot of other sectors for the same pool of labour, with sometimes better offers of that immediate pay condition at the start of the work journey, and that's a problem.
Well, let's pick up on that with our three representatives from different trusts. Patricia, let's start with you. Is what Anne and Karen are saying resonating with you?
It is absolutely resonating in terms of how do we get a workforce in? You know, look, as a health service, and I remember learning about this from a pub quiz, because that's where you get your best information, isn't it? That the NHS is the second largest.
Deeply worrying.
Isn't it just second largest employer in the world after the Chinese army? So we are a phenomenal employer, an anchor institution. Just within Shropshire, Telford and Wrekin, ourselves and the social care sector employ 20,000 people across Shropshire, Telford and Wrekin out of a population of 485,000. So that's a phenomenal, phenomenal number of people that we employ. And there's more that we can do. And we're all battling against a sort of workforce issue. How do we get a pipeline of people to come in and work within the NHS? It is actually easier within community trusts. So we provide, in terms of our agency spend and locum spend, is less of an issue than within our acute trusts. And I think that's because we can provide a diversity of roles. And because we're, you know, Shropshire Community Trust, we do what we said, do what we say on the team. We're an integral part of the community, and we touch the community. People are more likely to come and work with us. One thing that I've certainly discovered and working in our close relationships with schools and colleges is the information issue. A lot of kids or people that haven't perhaps achieved academically don't actually think that the health service and social care is an option to them, and particularly the health service jobs, because, you know, they think that you've got to have a plethora of qualifications in order to be a nurse or a doctor or a paramedic, rather than thinking that there could be a pipeline of ways of which we can open up opportunities and different roles and so on, that allow people to get onto a career ladder that may actually progress them to become a doctor or a nurse or a paramedic if they want to, or other roles. So there's something there that we're certainly doing, both as an organisation, a community organisation, but as a system, around getting the message out there and having that real dialogue with people so that they understand the breadth of roles that can be provided. So I think there's a lot more that we can do in terms of really getting in there in terms of schools and colleges to educate and work with local communities so that they can understand what kind of roles could be on offer. But yeah, it's a challenge, and it becomes even more of a challenge in areas such as mine, which are 60% rural. So connecting with those harder to reach communities, and of course, you know, a high population of the over 65s. So we're in the business of trying to encourage people to come into Shropshire to work for us. So that, you know, a challenge of an aging workforce and getting access to people of workable age, as well as the remoteness of some of our communities and how we connect to them as well.
Talking of remoteness, let's talk about North Cumbria, Justine, because I don't know, Patricia's saying 60% of people live in rural areas. I guess in your area, it's much higher than that.
It is. It poses new issues. We're a bit disconnected from other parts of the country in terms of it's quite a long journey between other major towns. So we're working on how do we make Cumbria attractive rather than just our trust, because it's not about just pulling people locally from surrounding northwest or northeast. We're wanting to pull people from, you know, maybe northern Scotland, South England, but now more internationally as well. So,
and how do you do that?
Well, at the moment we've gone quite heavy into international recruitment to understand what's available out there. We've probably now got about 160 international nurses come over in the last 12 months, which is, you know, a phenomenal amount. And to be honest,
where do they largely come from? Because I think that there's this sort of ethical issue, isn't it, about recruiting from foreign countries, about whether you're sort of taking people from countries that really need them at home themselves.
And I think there's a good argument there for that. And we've been taking many of them from India at the moment, but obviously, you know, it changes over time. And particularly when we had COVID restrictions, we're looking, you know, where else we could perhaps source in future. But what we're finding when we are bringing people from abroad in, they are actually bringing families now. So when we're bringing them in, it's a case of, can we offer them a career for their other family members, you know, the husbands or teenagers, you know, about to go on to a career. So I think not just about looking at our healthcare offer, what else is in the local areas to offer as a bigger package. So, yeah, I think the answer here is about pathways across sectors. You know, there might be some joined up roles we can do with the care, social care areas. So we've got a better career plan for people, because it's when we're starting off with the young workers, can they actually see where that career right ends? You know, if they see a job and they think, well, that's pretty low level, I might as well go and work in hospitality. Hospitality might be more of a, you know, a dead end job for them, but maybe they can't see where a career path being a healthcare assistant could lead to if they got the healthcare certificate and things like that. I think a lot's around communication. I don't think it's always around the pool of what we've got. I think it's definitely the attraction and the communication and engagement at that school level, community level. You know, it's that creating creating that excitement really to want to come to us, and I don't think we're very good at that.
Jodie, let's talk about your area, Airedale. Just explain for people watching exactly where Airedale is and what it encompasses.
Yeah, so very similar to the other two colleagues, we are quite rural, and some of our patch actually is completely rural up into the Yorkshire Dales. So we've got a really diverse area that we cover. It can cover quite privileged areas in our local towns, and then quite affluent areas, as I say, up in the Yorkshire Dales. So we are really having to adapt quite significantly and have a really many and varied approach to these different situations to try and attract people. We're very close to the cities of Bradford and Leeds. So one of our problems is to try and you know, encourage people to stay here and not go to the bigger teaching hospitals in local cities. Something else that I wanted to pick up on was sort of personal experience. I've actually progressed from being starting out as an apprentice when I left school, and I always just wanted to work at my local hospital. I don't know if that would be incorporate not actually dreaming that big, but that's what I wanted to do, and I have slowly sort of worked my way up. progressed, developed new skills. And I think that's really, really important and something that we should be doing. The second thing that I wanted then to pick up on about that is the role that our NHS charities, the charitable arms of our NHS organisations, the role they can play. We've talked about schools already, haven't we? I know, for example, our NHS charity, we go out into a lot of schools to do a lot of education, to work with them. It's a lot of our social value work, to tell them what is going on in the hospital, and that there are the different jobs that are available. So there's definitely a lot of things that we could do around this.
That's a really interesting point. Just diverting on that for a second, because when you go to schools, is it at your initiative that you contact the school and say, can we come and talk to your kids, or is it the schools that contact you?
Both, to be honest. Yeah, absolutely both. We one example, we've worked with a local school that's in an inner town area that isn't in the most affluent area, and the relationship with them started because they wanted to do some fundraising for us, which was just phenomenal. They did that in the middle of lockdown, raised an amazing amount of money, and so we've worked on that relationship and developed it and grown it with them over time, and so they actually have asked us to go in on a number of occasions now, because we've got that sort of link with them, and we don't just leave that one bit of fundraising where it was, we grow with it.
Because in a way, I suppose there's that phrase where you've got to get them when they're young, and I just wonder how proactive some schools are in this. I mean, I'll give you a couple of examples. My old school in Saffron Walden in Essex, I'm listed on their Wikipedia page as one of their most famous alumni, which I thought was hilarious. Have I ever been invited back to speak to them? Now, am I going to write to them or email them and say, would you like me to come and speak to you? No, I'm probably not. Because I mean, it's not a very British thing to do, is it? But when I have been to the schools, I went to one in Ilford. It was 85% non-white, quite a poor area in many ways. And I must admit, I never know how to pitch things when you go to a school, particularly when they're from 11 to 18. And I talked to them for about, 45 minutes, and then they all asked questions. I always remember this little boy in the front, 11 years old, put his hand up. First question, how much do you earn? I thought, great, what a great question. And the head teacher wrote to me afterwards, and she said, you won't realise this, but that was probably the most important hour in those children's schools' lives. And I was thinking, really? And she said, well, you showed them that you can you can aspire to things, and that's the most important message that can be got across. But I just wonder how many schools are doing that. And you've been an education minister, and obviously a constituency MP. What more can be done to encourage schools to invite people like Jodie, Justine, Patricia in?
Well, your point is well made, and Jodie is exactly the example that we want. Yeah. Somebody who started as an apprentice. So, 20-second podcast, Jodie, is what you need all over social media. This is where I started, and this is where I am. I actually did the career strategy, and the trouble with careers generally, which is what we're talking about in schools, it's never easy to get it right. And to some extent, schools and colleges respond to the marketplace. So, lots of parents want their children to go to university. And in fact, university is not the right route for many young people. Probably not as many as go to university. So I think it is absolutely crucial starting in primary schools. The work that people like Karen do is fantastic with apprenticeship fairs, but getting in there and using existing apprentices as ambassadors, I think, is another way that can be done. So it doesn't need to be people like me who are very old. Ian, you're a bit younger than me, but we have a story to tell. We have a story to tell, but there's nothing more powerful than getting existing apprentices to go into the schools and say, follow me. And the point Patricia made about the fact that people can get into a pipeline. I think that a lot of young people, particularly if they are not doing particularly well at school for whatever reason, believe that organisations like the NHS are just not going to look at them. They probably have low self-esteem, probably because they're told constantly that they're not working hard enough or not doing well enough in exams. What they need is confidence. What they need is a receptive front end of the organisation. So if they do pluck up the courage to send an email, send a letter, send a little video of themselves saying, I'm looking for a job, the NHS needs to respond to that really, really quickly and in a really positive manner, because there will be a slot for almost all of them somewhere in the organisation. And the bottom line is that school doesn't work for lots of kids for a variety of reasons. But within that pool of young people and indeed older adults, you know, your ageing population can be an advantage, because there's nothing to stop people like Shropshire Community Trust taking on apprentices at 50, because you're going to get 15, maybe 20 years work out of them. Very valuable members of staff. So it's about making people realise that it's possible. Whenever we talk about this, I often think of the army. Do you remember all the adverts that we've had for the armed forces? The NHS has always been rather slow, and if it publishes opportunities, it's always somebody who's a nurse or a doctor. And that's a shame, because it disguises the huge variety of roles that exist.
And actually, given the amount of goodwill there is towards the NHS, as we hopefully come out of the pandemic, this would be the ideal time for the NHS to launch a national campaign, let a local one, sort of "Your NHS needs you." Those sort of posters that we all
needs
remember.
You, and it's not all about caring, because you know, you talked about the 10% youth unemployment. The trouble is, a lot of young people in particular think that it's about, you know, being by the bedside of a patient, and they say, you know, I'd hate to do that. It doesn't feel very glamorous for people who, but it's all those other roles that we need to advertise, make people aware that exist.
Karen, I imagine looking around everyone who's taking part in this, you probably, and maybe I'm stereotyping here, but you probably represent more of a diverse community than anyone else here on the panel. How easy is it to get to diverse communities, whether they are from ethnic minorities, whether it's sort of a white working class council estate? Because there are lots. I mean, that's really what we're talking about here in terms of levelling up. Let's not beat around the bush. How do you get to them, people who might not, I don't know, sort of necessarily watch or listen to the same media as the rest of everybody, the rest of the country?
Well, I mean, without, you know, another outpouring of agreement with Anne, I became a member of Parliament at 50, so I think there's plenty of productive years.
I became a radio presenter at 50. So
there you go. See,
and I became an MP at 50 too.
So good advert.
Well, let's have a group hug.
And I was going to say that the thing that got me particularly motivated in my constituency, which is largely a large white working class constituency, was women in their early 30s who'd had their children, who are desperate to have a career. And let's face it, they've got another 30 years worth of a career in front of them, and were caring in some ways, perhaps on a HCA, at a healthcare assistant level, or in a care home. And the ladder, as I described it earlier, of apprenticeship just isn't there for them. So I don't think we need to do that much to get to them. We just need to, we know who they are. We certainly learned in the pandemic, didn't we, where all care home workers are from. They're all local. They're predominantly women, and they're predominantly, you know, younger women, and then women perhaps post 40. So we know where these workers are. We also know that a lot of them are in community services, and a lot of them are in GP, primary care services, again, because they tend to work very locally. That's perhaps because of other caring commitments, or indeed because those very local institutions are much better at attracting those local, particularly women. And I think the NHS, as this large organisation and large acute trusts, just doesn't do that. They tend to look upwards and outwards. They do tend to look for doctors and senior level graduates for those sorts of jobs. So if they could learn from the institutions that are already in their patch, which are also anchor institutions, every care home is an anchor institution, every GP practice is an anchor institution, and support them, I think the government would have some very quick wins. And actually, the quickest way to level up in these communities for the working class populations and for BME populations who are also more dominant in these sectors is to pay them properly. You know, I alluded to this earlier, but in parts of the south, and I'm not okay with the colleagues on the cause areas, but you can get £15 to £20 an hour for dog walking and cleaning. and it's less than £10 an hour in many places for care work. It's not hard, is it really, to think about how you can very quickly level up? So if Anne can persuade the government to look at that pay comparator, not just across the NHS, but across those other hospitality sectors, then I think we go a long way to both levelling up quickly and sorting out the problems we have with care, recruitment and retention.
That's quite difficult, isn't it? Because although the NHS is a government employer, most care workers are actually employed by private sector companies, aren't they? And there's very little that the government can do about that.
The funding is largely through local authorities. Sorry to cut across you.
No, feel free.
Sorry to cut across in. They are largely funded, though, through local authorities, through government, and can set the national pays and terms and conditions, and indeed, which they're trying to start doing, is looking at skills and recompensing skills across the sector.
Justine, sorry, Anne, go on.
No, just to back up a bit what Karen says, they are funded through local authority money, and I think that the pay it's certainly in social care is pretty scandalous. In some places, as you rightly say, you can get more money being a dog walker, to be honest. And you know, the big elephant around health and social care is social care. It's never really been looked at properly. Nobody's really got to grips with it. There's still not a plan. There has to be a career ladder within social care, and with that go associated salaries. But I think that the NHS is going to struggle. I was talking to a business recently who's paying around £9 an hour for entry-level jobs. They've got some big warehousing outfits near them. They're jacking their pay up to £12 an hour to try and get ahead of the market. So the NHS, with national terms and conditions of service, is really going to struggle. So I mean, I think this is something that's going to come down the tracks, but nonetheless, still, the opportunities for those furthest from the labour market, those who are disadvantaged in the labour market, the opportunities in the NHS are fantastic. It means the NHS Trust going out and grabbing them, as you say, going into those communities, getting them by fair means or foul, really. It doesn't really matter. It can be through youth centres, it can be projects that are working with more disadvantaged communities. There are loads of ways to get in, but letting them know what opportunities exist.
Justine, what are the barriers in a rural area like yours? Because, for example, certainly the area that I know best in Norfolk, if you are a care worker, you are being paid a fairly low wage, as Karen says, and then you aren't paid for driving from Wells next to the sea to Cromer to see a different person. You're not paid for that. You can't claim your petrol either. I mean, that is scandalous. But in a rural area like yours, this must be a real problem in attracting people into the sector.
Oh, it absolutely is. I think there is a pay issue here. However hard we try and think we haven't got one, we do. So if you look at the social care issue and even looking at healthcare assistants there, they're so struggling to recruit, yet we don't have quite the same problem because in our trust we have upped the pay. And when we've done that, that means we're then attracting the healthcare assistants. But then the problem is you've got a knock-on effect in the rest of the system because we're then, if you like, taking some of the best of the crop and pulling it towards our trust. And they do compare, they do, you know, it's a small world, isn't it? So the pay is definitely something that is affecting those lower ends. And I think the lower ended job roles in terms of pay, once you've got someone hooked in at that level, then the hope is if you've got a proper career progression, we'll keep them. And that's really where we're coming to, is try and get as many people as we can in at those lower levels, which are about 85% female. A lot of them are mothers, carers, maybe some of them are returners. So we do have to wrap around a lot of flexible working for them. And then hopefully this will outweigh some of the problems we've got with people having to travel to come to the workplace. But we're doing a lot more agile working now as well. I think COVID's opened our eyes to the art of the possible, what work can still be done remotely. So it'd be interesting to see if that does have a good effect as well, you know, in terms of having a workforce that is a bit more attractive in terms of where the work can get done.
Jodie, what are the main barriers you face in your area?
I think I touched on it a little bit earlier, but the main thing for us is that we're so close to cities that have teaching hospitals, and as Justine's just mentioned, a lot of the time the pull either for the pay or the better experience that they may feel that they'll get in those city hospitals can take away from the fact of working in a smaller rural hospital. For us though, people that live in our catchment area, they will then come to work with us, their families that are patients of our organisation as well. So we really do sort of home grow quite a lot of our staff and try and do that career progression for them. And as we've mentioned previously, you can start as a cleaner, work your way up to a healthcare assistant, and by the end of it, you could become the chief nurse or the chief executive just by training on the job. So it's really important that we capture our local residents and help them to grow as well.
And I suppose getting real life examples like you, somebody, as you said earlier, that sort of worked up from the bottom. I mean, that's got to be the best way of showing people that they might well start at the bottom, but they're not going to be there after 10 years if it all works out. I mean, are you sort of doing lots of multimedia things in that area to try and attract people?
Yeah, definitely. Yeah, we just try and get
TikTok.
Not quite TikTok.
Well, that's apparently where the young people. I've just been forced to go onto TikTok. Can you believe? I haven't done a dance yet, but that's where young people are predominantly now getting all of their stuff from on social media.
Yeah, absolutely. And again, going back to our charity, it's a way that actually we've got quite a lot of freedom to go and explore those different social media channels so that we can get the right message to the right person at the right time. So that can be, talking about the jobs and the careers that we've got at the hospital, and talking to the people that have obviously got an interest because they may have fundraised for us or something like that. So social media is definitely a big part of where our organisation is going.
Now, Patricia, you've been nodding away over the past 10 minutes or so. What would you like to add to this part of the discussion?
Well, sort of going back to sort of the care sector and the importance of parity of pay, I think is a really important point. I think the NHS can and should be an active employer in terms of providing a pipeline, but part of that pipeline is also working in partnership with local authorities, local providers, because actually, I'll give you an example. In the last few weeks, in terms of the care home sector that have struggled in terms of infection outbreaks with Omicron, where we've provided infection control and support, but also training and support and mutual aid into those homes in terms of some of our healthcare support workers working into the care sector and vice versa. And I think there's an opportunity, and again, working with some of the domiciliary care agencies to say, can they be part of our community neighbourhood teams so that we're not undermining the market, but actually supporting the market and the pipeline. So whereas it might be a little bit more difficult for a small domiciliary care provider to provide a pipeline of career progression, actually working in partnership means that potentially as they're bringing through carers on lower banded pay, that we can provide some training and support that then propels that individual onto other careers and within the health service or within social care, so that we're getting a pipeline that includes those providers as opposed to, I just want to make sure that my workforce is covered, thank you very much. So this is about us being part of an anchor institution, which isn't just about the health service, but it's about health and social care and the wider community, also with charities and voluntary sector as well, so that we start to work in partnership. Organisations like mine, which are community trusts, are far more agile in doing that, and so we see ourselves as a feeder into the acutes as well. So it's thinking a little bit differently about how the health service can be not only a direct employer, but a support to other employers in the area that creates that ongoing pipeline. And I think that's an important point. Pay parity, but also pipelines that link together, not just about solving one part of the problem in one part of our community. It's about how we work together on that.
What's the main barrier that you face in terms of recruiting people? I'll ask Justine and Jodie this in a second as well.
So some of the things that Anne talked about in terms of we are within the NHS a bit of a bureaucratic beast, and so some of the problems relate to our own slow, clunky processes around recruitment, which we need to change. You know, the ability to get joint contracts. You know, through our ICS, we've been doing an awful lot of work to think about, you know, it's an STW employment offer that we're providing as opposed to individual organisations. And I won't bore you with some of the complexities around that. You'd think it'd be easy. But so there's something around that we're creating a bit of a problem for ourselves. Reaching out to communities, you know, as I say, a lot of our local population are in the older age brackets. And so we're having to think a little bit more agile around how we go out and pull people in from different surrounding areas. We need to think differently about transport offers, about packages for people in terms of rent, housing. Shropshire's a lovely place to live, but housing prices are very high, rents are high. Transport around the county isn't easy in terms of public transport, so it's reliant on people having cars. That has an impact in terms of, certainly for the lower graded staff, around transport costs, fuel costs. So thinking a little bit more laterally about how we can support with some of those elements that make it a little bit easier and therefore more attractive for people to get their foot onto that particular ladder. So those are some of the challenges that we've got in living in a rural community.
I got more than I bargained for there, Jodie.
Yeah, how do you follow that? So I think,
say what she said.
Yeah, all of that. I think definitely trying to sort of, I can't think of another word for it, but to glamorize and to make your organisation attractive to somebody is a really, really big sort of barrier if you don't get it right. As I've mentioned, you know, our area is in the top 10% and then of income, but then also the bottom 10% as well. So it's getting it right that we've got this diverse community. Yes, we have, but actually it is attractive and there are things that you can get from it, and it's definitely a place that you can come and have a career for your life if you want to do that. But equally we are commutable from other areas, and that's a really positive point as well.
Justine.
Thank you. Agree with all that and all that before as well. So very good. Where we're, I think, seeing a big emphasis is around the actual workforce planning. So what is it we actually really need to begin with? Are we actually sure? Or do we just do a lot of work around just replacing like for like? So I think we need, as a care system, a better way of collating, I think, good quality data on what art of the inevitable would look like. So what do we actually need in 3 to 5 years, so that regionally and nationally we are working with the universities really closely, which is what we do at the moment, but are we actually looking at new types of roles, new models of delivering care? And where I guess a little stuck with that is when we get down to the management levels within, particularly in our trust, and say, if you were to redesign and make this pathway better, make it better for the patient across the system, what would this look like? What would you do to move the existing roles you've got into new roles? And you know, quite often I see a lot of rabbits in a headlight with that, and I think they don't free up the time enough to talk to the partners in the system all the time to have these conversations. They're very much into the day-to-day activity, particularly over the last couple of years. I think everybody's heads down, just try and get on with the day. So I think there's a big piece of work around, you know, what could we do differently? And there's some really great examples out there in some really forward-thinking trusts of what that looks like, but I don't think we've all got to the same place. I think we've got the time to market and recruit is too long. We are clunky. They agree with that. We're not very innovative. you know, we haven't always got the right skills around us, and we're not very good at the incentives that we could put forward. Private sector are much more fleet of the foot. You know, they can agree quite quickly, oh, we'll spend 2,000 on a golden handshake here, we'll go and invest some money there. It's very hard to get a spend to saves initiative sometimes out there. So doing more upfront is a lot harder sometimes to sell them, and by the time it's been through the processes, it's kind of being half kicked into the grass, which is I think that's just a culture in some parts, I think, of our healthcare system, and it's not all parts. And for us, particularly accommodation, particularly over in the west of Cumbria, we have very little affordable housing available. So when we do try and attract people over, we've nowhere to actually house them. And that is a significant problem. It might not sound it, but it is quite huge for us, that. And, you know, we're trying to work with the local authorities, etc., and housing associations to see what we can do, but we really are stuck quite often in getting the right numbers here. So I'd say those are probably the kind of three big things we're struggling with.
Okay, well, Karen, imagine this scenario. Labour government comes in, you're a health minister, you've got all sorts of ideas of what you want to do, but Rachel Reeves, the new chancellor, says, well, you can't have any more money, things are really tight. What can you do in central government to make Patricia's, Jodie's and Justine's jobs easier, to help them achieve the things that they clearly want to achieve?
Well, I think that they've offered us the solutions, and I'd actually written down transport and housing are really key to this. Walking around Westminster a couple of weeks ago, looked up, and there is Westminster Nurses' Home is still engraved in stone on top of what is now very private luxury flats. It's not that long ago that we did have housing for new recruits into the health service. The Cameron government did talk about key worker housing, and that's kind of gone off the boil a bit. Again, that's something we should resurrect. The government have talked about in the white paper housing being part of the solution for people requiring care, but I think we've lost sight of housing for people giving care, and that's something that I would like to see happening, joining up across government. And transport, I mean, I represent a city seat, but transport for the poorest communities, this is why I go back to my earlier point, why the local care homes and domiciliary providers and GP services can recruit, because people don't have to get transport there. Transport is an issue in cities because of the cost of it, and as well as rural areas. So, I guess it's the holy grail of joined up government, Ian, which we'll have all heard quite a lot about. But there are some very simple solutions that I think this government, and hopefully, should I be Care Minister, I would be able to enact working with colleagues, because buses, public transport across the country unlocks so much levelling up and access to good jobs, and that would make Justine, Patricia and Jodie's jobs easier, I think, as well as the training, which is is costly. But we do need to think about, when we pay these people properly and we have them in work, they are spending money in local economies, and they are beefing up the high streets. So we do need to see care and health not as a pit in which you sink money. We do need to see it as a driver of local infrastructure and a driver of the local economy. And that, to be fair to me and my colleagues, and Rachel Reeves is very cognizant of that, using the public and the private sector as drivers of that local economy.
Has the pandemic changed things? Because I think it's changed the relationship often between an employee and an employer, because employers have had to change their ways in all sorts of different ways over the past couple of years. Employees have had to adapt as well. And I guess there's the whole issue of looking after the health and well-being of staff as well, because everyone has different needs. Some people are, should we say, more robust than others. Some people adapt to change better than others. And how do you think the pandemic has changed things in the long term?
I think the jury's out on how long this will last, but I think it has changed things more significantly than we are currently aware of. I think one of the difficulties is that life became very unpredictable, and I think still is. And as with the financial markets, if you have unpredictability, the markets lose confidence. I think on a very individual way, people have lost confidence because they don't know what's going to happen next. And if you look at the choices that young people have made over whether they go to university or not, people are doing things that feel currently quite safe because they feel quite insecure with that loss of confidence. So I think it has. I think that there are a couple of points I pick up on. It was Justine, I think, who talked about a headroom. I think one of the difficulties for the NHS, and I've had associations with the NHS for longer than I care to mention, actually. It's been a very long time. But the story has never actually changed. Difficulties of workforce planning. Workforce planning is a little bit easier if you know what the government is going to do. So government changes policy and then you need a different workforce. So if the current thing is to look after people in their own homes, then you need a different workforce than you do if you're going to look after people in supported living, say. So I think it's quite difficult to do at the best of times, even more difficult when government changes policy. But I think the critical thing is the headroom to do things differently. And what has changed for the health service, and I think it's probably going to be about 10 years before the NHS recovers from the pandemic and gets back to any sense of normal life again. What it absolutely needs to do is to have the headroom to design solutions that work locally. And it's a bit of a cliche saying that. There's no point in wishing that government worked together, that health and social care work together. They work as they do. We've been wishing it were different for a very long time. What we need to do is to free up the health service in the way that Patricia was talking about, looking beyond your institutional walls and your financial walls, working together, supporting each other. But in order to do that, you've got to free NHS organisations to be able to feel they can do that. It is still a very top-down structure, in my view.
Just on this idea of what the pandemic has changed, let's go to each of the three trust representatives here. We are slightly running out of time, so if I can ask you to be relatively brief on this. Patricia, let's start with you.
Yeah, I mean, we've needed to be far more agile. So you sort of absolutely echo what Anne was saying, is that we are at the moment feeling that we're just trying to sort of manage from day to day to day in terms of the demand that's coming through the door, but also the, very cognizant that we also need to transform services, deal with backlog, and think about how we deliver care for the population to meet the population needs in the future. And that headroom is really important when you're dealing with a really tired workforce. So we've just had our staff survey results, which have been hugely positive. We had the highest turnout of our employees responding to the staff survey, all of them still saying they would very much advocate to people to come and work with us, that they have a high level of staff satisfaction in terms of the care that they're delivering. But what they did demonstrate through that is how tired and how frustrated they feel a little bit in not being able to have the headspace to change services in the way that they feel is necessary to meet the current needs and the ongoing needs of their patients and residents. And our service providers feel that, because we are part of the community. Over 90% of our employees are local Shropshire residents, so they're not separate to what's gone on. So yeah, I think having that headspace for frontline workers and for back office workers to work through some of those local solutions in an integrated way is going to be really important. But also, changing the expectation of how we're going to deliver in the future, because we are not going to be able to clear backlogs in the next 12, 18 months. And so we need to have a different dialogue with the public around how we provide care now and in the future, I think.
Justine.
I mean, I absolutely resonate with all of that. Our staff are very tired. I think it's bad enough going through the COVID, but as you've even coming out of the COVID, it's the backlog. It's never ending. They can't see an end to this. We've asked for so much from the staff, and then we're still asking for more. And like I say, I think this is going to go on for a number of years. They're struggling with the priorities. you know, what is our priority? Obviously, it's the patient, but then we're also saying, you know, you're not doing a lot of time for your basics, you know, the development of the staff, the well-being conversations for the staff, the appraisals, setting the objectives, all those things are getting pushed further into the background. And they can't be, because they're so fundamentally important in engaging everybody and making sure you know, they're fitting well and doing a job and they're focused. But they're the things that always get sort of left behind when the times are really hard. So it's how do we protect that time for them? You know, and that's the difficult question for me. How do we protect and wrap some time around some of these key managers and staff so that they've got some space to even just collect the thoughts or recover from whatever it is that they've just been dealing with, which could be, you know, emotionally quite disturbing for them. So, and it's not just the nursing. I'm not looking at nursing or medics here. I mean, we see it in the porters, you know, the people who've working in the estates. It's riddled right through all the support services. Our staff survey, unfortunately, wasn't great. We weren't expecting it to be, but it still wasn't great compared with others. We've got a lot of work to do, a lot of turning the lens on ourselves. But the message that comes through more often than not is, you know, managers just aren't taking time with the staff. It's too focused on the here and now and churning through the day. And that's a difficult one when the priorities are there, aren't they, to get the waiting lists or the patients seen. Thank you.
Jodie.
Yeah, this is a topic I could talk about all day. I won't, but I'm really, really proud of what we've actually been able to achieve at Airedale, particularly in terms of the charity side of things. And I definitely think the same will be echoed across the NHS. Colleagues in their NHS charities will be able to have delivered some fantastic things for their staff. I don't think we've always got it exactly right. Obviously, we've all had the challenges, but we've been able to provide psychological support for our staff. We've made sure that we've provided them with food and drink, a space to go away and to take some time out if that's what they've needed to do through the pandemic, and lots of other things. And we're really hoping that we can continue, with the help of our communities who did that through the pandemic, that we can continue to deliver those things. But one other thing that we have tried really, really hard to do is to communicate with our staff that actually we've been really fortunate that we have still been employed through the pandemic when others haven't. And so we've tried to encourage people to help us to give back to the community. So we've supported food banks and we continue to do so. And that's actually given a sense of well-being to our staff at the same time, because they've actually helped, or felt like they've been helping a lot more people than just the patients that they're seeing on the wards. So yeah, don't think we've, you know, accomplished everything we can just yet, but it's definitely something that I think there's some good points that have come out of the pandemic in terms of taking care of our staff and their health and well-being.
It's time to wrap things up now in a moment, because we've nearly reached the end of our hour. I just want to go back to Karen and Anne. Karen, let's start with you. Do you want to just sort of say a couple of words wrapping things up, maybe what conclusions you might have drawn from today's discussion, and any sort of helpful hints that you've had in terms of how you do your job?
Well, look, it's a pleasure to hear from these three leaders, and having worked in the sector myself, I'm just always amazed by, I mean, how much resilience there is and how much ambition there is, but they do need support. You know, we went into the pandemic with 4 million people on waiting lists already. It was already a problem. And I think people have been very honest about the task ahead. Whilst people, you know, in my constituents are going to be waiting on those lists, they're going to need to be communicated with. They're going to need other services locally to help them manage with their conditions. They're going to need help so they can go back to work, that they can go back and care for people. So we are going to have much more intervention to help people whilst they're on the list, as well as recruiting people into the workforce to drive that local economy. And at the moment, I don't think we're quite there really about the scale of the challenge, but people are up for it. And we do also have to talk a good game. We need to have a good PR about this is a good place to work and a good place to be, and have the positives, because I think if we are too negative, then we're not going to recruit and attract people. But let's try and get that housing, that transport, this is a national challenge now, this waiting list problem, and we're going to have to, throw a lot at it. And I should just finally say, on a sort of political point, the private sector is not the answer here, because if staff just go and work for the private sector, then it's going to leave the state sector more depleted. And if we are serious about levelling up, that is really deeply problematic, because we know that health inequalities have got worse. So whilst the private sector has a role in helping get through some of the treatments, we can't have that as the natural recruiter of staff, and we have to support the health and care system to recruit and retain staff, or else we really won't do anything about the health inequalities that that are now so much worse than they were when we started the pandemic.
And Milton, some concluding remarks from you, please.
Just to back up what Karen said, because I write a blog every couple of weeks, you're very welcome to look at it. The figures on health inequalities are really, really dire. They're awful, not just because of the pandemic, but if you look at the correlation between things of rates of vaccination, deprivation, it is really a shocking picture. And I don't know why we can't get anybody ever to really grasp hold the awfulness of this, that we shouldn't in a first world country have those sort of levels of health inequality. But I think the very striking thing about today, and I'd like to thank everybody, Karen, for your time, but also Justin, Jodie and Patricia, is that you work in completely different places. And one of the difficulties, I think, for the NHS is that it is, as I said before, it is done unto. Orders come down from above. And actually, you are working in completely different environments. Justine, obviously struggling hugely, having to ask staff who are already tired to go the extra mile. Jodie, you've obviously had some things in place that are working, but the point is, the commitment is there from everybody on the call today, all the staff within your organisations. What you need to do is to get the tools that will help you. That is not a universal thing. Different trusts need different things, and different things that will help them to get out of the other side. And I think that at the moment, I was on a call earlier today, trust between NHS staff and government isn't in a great place. I don't think the government needs to do anything very exciting. I think actually the health service would be very pleased if the government didn't do anything exciting. I think we just need to take a back seat, give different trusts what they need to get through this and get on doing what they do so superbly well, and that is caring for the patients that they look after, and also playing their part, which I know all of you want to do, in levelling up this country.
Well, it's been a fascinating discussion. Thank you all for joining us for the last hour. Jodie Henshaw, Karen Smith, Anne Milton, Patricia Davis and Justine Steele. If you've missed any of the other Levelling Up seminars, you can get them on the Levelling Up Goals website. And join us again next time. Goodbye.